Hi, everyone, and welcome to our Thursday morning practitioner call. It's 9 a.m. Pacific time in California. And this is my favorite call of the week because it's practitioners talking about LifeWave and the different tools in their box that they can use to help their clients. Also, we have clients on the call to learn, and they also talk about what's been happening with them. It's a bit of a round robin. We have Dr. Patty, who is a MD living in Carlsbad, California, and we are blessed that she is on today. So of course, we love hearing how Dr. Patty is using all the technologies. Dr. Patty is an MD medical doctor, and we'll have her talk a little bit more about who she is and how she came to be with the patches in a moment. So with that, thank you for coming on the call. And, you know, Dr. Patty, we're going to do this a little different today. Let's start with you. And I'm going to make it a little more of an interview, you and me today. We're just going to change it up a little bit today. So if you could unmute yourself, you better be ready.
Okay.
So Dr. Patty, let's first start with who you are, what type of doctor you are. Like, just can we know who you are a bit?
Oh, sure. It's nice to see some of you that have been around. You probably already know enough about me, but I'll just briefly share. And I went to medical school midlife as a second career. I was a music teacher in the first part of my life, so I'll probably identify with some of you. And I went because of chronic illness that I had and family and friends had that I saw was not really being managed as well as I would have liked to have seen with Western medicine doctors. So I've been involved in sort of the holistic alternative medicine long before I even went to medical school, and have continued that throughout, working with stem cells and patches and peptides, and now the patches. So I've been at this now for about 4 months, and so I'm a newbie, but just loving it and learning all I can.
So Dr. Patty, explain that really quick. I believe I got, you're a naturalist, but you're an MD. What does that mean exactly?
So I went to regular Western medicine school. I went to Texas A&M, and I'm from Texas originally, and I wanted to have those credentials of an MD. And then I also got a master's of public health as well, which has certainly been in the news a lot over the last couple of years with COVID, and it's a good additional tool to have. And I wanted that so I would have those credentials and that knowledge. But most of that knowledge, we learn pharmaceutical drugs. That's the way that medical schools are set up now, as the way that you learn. You don't learn about Ayurvedic medicine or homeopathy or Chinese medicine. You just learn about pharmaceutical drugs. And so that's one avenue, and I'm glad I know that. But I also have done a lot of study in many of the other areas that I think are important to put as a tool in my toolbox for my patients. So I've studied Ayurvedic medicine, homeopathy. I do low-dose immunotherapy. I do a lot of different things like that as holistic, because I see the whole body, mind, and spirit connected.
Wow. So with the credentials of an MD, you can live in both worlds. You have the credential of an MD, but you can treat with a combination of both approaches. You know, all I know is I need to know the address of your clinic, is what I'm saying. Wow. So with that, doctor, given that you understand all sorts of different modalities for healing, how did you learn about the X39 stem cell activation patch? And tell us a little bit about the technology of this patch and why you like it.
Yes, well, I learned about it from a patient. And that's what I love about being in holistic medicine, is that, you know, we really have time as doctors to listen and work with our patients. And she was benefited from it and was telling me about it. And it sort of perked me up because I had at that time a chronic pain issue. And I thought, wow, she was telling me about the IceWave patch and the X39. So she also said that her OB-GYN had told her about it. And I thought, well, that's another doctor. I'm going to look into it. And I learned that the X39 stimulates stem cells in our body, and the GHK copper peptide. I was using GHK copper peptide injectables with myself and my patients. I had been using stem cells in patients and in myself until the FDA took that away from us as holistic clinics back about 1.5 years ago. And so I just thought, wow, if we could get something in a patch form and how easy that would be. It was so economical compared to anything else out there. And I got very excited about it. Yeah, I've got my patch on here too, so.
So tell me quickly, this is kind of interesting. You just explained a little bit about X39 and that you used to do stem cell injections, but now you can't. And that you used to do GHK copper peptide injections, and now you use the X39 instead. So explain a little bit about GHK copper peptide injections, stem cell injections, and why you moved to the X39 instead.
So if you still want to get IV stem cells or intranasal stem cells or injectable stem cells into joints, you have to go somewhere besides the United States to get them. So those really aren't available anymore. The injectable peptides, some of them are still available. The issue with that is that you are giving the peptide itself and it has to be injected. And I would say at least half of my patients would go, I can't, stick myself, even though it's a little tiny needle, that's going to be too much. And so they just wouldn't get the benefit of GHK copper. And for 1 month of GHK copper injectable peptide, you're going to be paying about $350 a month for that. And it's not cheap. And so when I saw the patch option, a third of that cost for sure. And the fact that I didn't think anybody would turn that down because it's just sticking a little Band-Aid on your, body instead of having to inject. And I knew it would be so wonderfully super safe because we're just causing our bodies to make more and do a better job of creating that and releasing that GHK copper. And that makes it so safe for all of us like myself that are super sensitive to everything. And so I got excited.
So tell me, doctor, you say a little bit is like a Band-Aid, and we're talking X39 right now, and we'll get into Ice Wave for a second favorite patch in a moment. But if you look, this is what she's talking about. The doctor's talking about, it looks like a Band-Aid. And you literally stick it on your skin like a Band-Aid. And it's a form of wearable light therapy. What that means is that this patch, if you open it up, and let me just open it for you. You see the white inside? That's organic crystals made up of amino acids, some sugar, some salt, and some water. It forms a lattice. And when it hits your skin or the heat of your skin or the low-grade infrared light coming off of your skin, which means the same thing, turns out that we are light. And we didn't really fully understand that maybe 20, 30 years ago, but now there's like red light sauna, there's red light therapy, there's laser therapy. We are seeing in the medical world that they are utilizing light techniques because our body works well with light. Just like when you go out into the sun, your body creates vitamin D. No, the sun doesn't put vitamin D in you. Your body works with the light of the sun and it activates your own body's vitamin D in just the right ratio. Isn't light interesting? So that's what this patch does. It reflects back your own light wave right back into your skin and elevates a peptide called GHK copper peptide. This peptide does a lot of amazing things, which we're going to ask Dr. Patty about in a moment, the amazing things it does. And it also activates your stem cells, makes more stem cells, and resets your stem cells to a younger, healthier state. This type of light technology is actually called photobiomodulation. Dr. Patty, what does photobiomodulation mean? That seems like a really big word.
Well, it is, and it's amazing all the things we can't see, but our body's doing for us all the time. And we know that red light therapy that our body just exudes, it just puts out, we know that that's a healing frequency. And some of you may have gone to a gym where they have a red light bed. You lie in it after you work out. It helps your muscles not be so sore. Or a physical therapist that puts a red light wand on you to help for healing. So that's what the body, that whole idea of photomodulation is, taking those naturally healing light wave frequencies and pushing them back into your body for a little more effective use. Because as we get in toxic environments, we get stressed, we get sick, we get older, all those things, our body doesn't work quite as optimally. And the patch enhances that natural healing of our own bodies. I love that.
I love that too, doctor. So let's talk a little bit. Now we understand the mechanism. Doctor explained photobiomodulation, which is really a fancy word for light making change in your body, right?
Exactly.
So let's talk about the change that X39 makes in the body. So one of the things that GHK copper peptide does, which by the way, the X39 has a 20-year patent that says, yes, the X39 activates GHK copper peptide in the blood, which stimulates your stem cells. You can find the patent at startx39.com. That's startx39.com under research and patents. And what you can see there is you will see the patent of X39. Also, there's about 100 other patents of all his other patches, as well as 100 research studies. So if you are a doctor listening to this and wanting to know, hey, where are those studies? Once again, it's startx39.com under research and patents. There's also a tab right next, a couple tabs away, that talks about the benefits of GHK copper peptide. While you're at it, click that. And lastly, about the third video is David Schmidt, the owner, the inventor, and the CEO, talking about how the X39 technology works and all the issues it helps you with. Remember, David is the owner of this company. This company has been here since 2005. The company has moved from doing about, in 2005, 30 million a year to now about 450 million a year. So know that David has brought this light technology and stem cell technology to the world. And now we're finally understanding what it does. He pretty much knew in 2005, but it's taken us 20 years to catch on. You know what I mean? So that's okay. He's a what's the word? A revolutionary, or a thinker before most. There's a word for that, and I can't quite remember what it is. I'm sure one of you will figure that out and tell me. So let's go back to stem cells. So stem cells, ready for this? I'm going to say what I believe stem cells are, and then Dr. Patty, I'd like you to give me some examples about the honing bird. So stem cells are the only cells in your body that are changeable. They can change into whatever cell your body needs to repair, just like when you were 20. So let me ask you this. All you practitioners on the call and all the clients of practitioners on the call, I want you all to think back when you were 20. Okay, you ready? Here's the question. Did you have gray hair when you were 20? No. Did you have any wrinkles when you were 20? No. Did you have that thick unibrow when you were 20? I did. Did you have that nagging thing that you have now when you were 20? Dr. Patty has symptoms of MS. I have symptoms of breast cancer. Did I have that when I was 20? No. So what if we could activate the armies to work again, to do the repairing, turn into whatever cell your body needs to repair? That's what stem cells do. They're changeable, right? They can be anything. Isn't that amazing? Anything. And then they go and repair what you need to have repaired like you're 20. Here's the problem. You ready? There's always a problem. With aging, stem cells go dormant. Okay, so 50% of your stem cells go dormant by the age of 30. Almost all of your stem cells are dormant by the age of 65. I'm 55. I would say Patty and I are roughly in the same age bracket. That means we were cool in the 80s. Okay, that's a long time ago. How many people here were cool in the 80s, right? That's about right, right? So that is interesting, right? They're not dead. They're dormant. It's like they went on vacation in your big toe or something. So what happens if you put that patch on, 12 hours on to activate and repair and 12 hours off? And by the way, you put that patch right below the back of your neck or under your belly button, 12 on, 12 off. Just what happens if you reactivated those dormant stem cells to work again like you were 20, right? This product is not anti-aging. We are literally seeing age reversal because we're activating our stem cells to work again like we're 20, and that army starts marching. They act as honing birds in your body. Dr. Patty, what does acting like a honing bird in your body mean?
So the stem cells have that innate knowledge. And the good thing about the kind of stem cells we're talking about that are present in our body is that they can do good things for us that we need by honing in to that area of inflammation that's greatest at that moment in time. Also, other stem cells can go to other parts of the body that have inflammation, but they particularly hone in on the biggest parts. They're not the kind of stem cells that can grow us another head or a new nose or something like that. They're the kind that help our body to do what it can do best. Whether we've got a joint issue, we've got chronic pain, we need to be regenerated just all over our bodies, right? And that's what the stem cell patches do. They hone in on those areas of greater inflammation. You may not feel anything right away with a patch because maybe it's working in your liver. Other people like myself, I felt something the first day. I had an energy issue and I felt more energy that day and a greater sense of well-being. So it just depends, but that's how that honing bird stem cell works. It knows right where to go in your body.
You know, Dr. Patty, explain that more. I think that's interesting because when I talk to people, some people say, oh, I have that really arthritic knee. And I put that patch on and in 5 days, I can walk on it again. It doesn't hurt. And some people say, Marci, I put my 5-day supply on my shoulder that's been out for years and it still hurts. I don't feel anything. Why do some people feel something right away? And some people need more, like 30, 60, 90 days. What's going on?
I think that every person is so different that it's hard to say for sure. But what I would say, and again, this is not a time where I'm giving treatment advice or trying to cure a disease. I'm just sort of sharing with you my own story and the story that I've had with patients. But I feel like that I encourage them to say, you've just got to trust your body and that the stem cells are treating those areas of greatest need for you right now. And even though your shoulder might really be hurting, you may have something else even worse. Maybe you didn't even know about it, but your stem cells have more innate knowledge than even we do. And so I think that I always want them to know they need to be using that stem cell patch for every decade of their life for a month. So if they're 40 years old, 4 months minimum, 66 months minimum. And then you can feel like you're beginning that great repair. And then other things of the regenerative can start in at that point in time for sure.
You know, my friend Bob told me this, and I thought it was really interesting, Dr. Patty. He said, I started the patches and I didn't feel anything. And my guess is that he had some organ thing, because that's what is important, honestly, even though we don't realize it because we don't see it or feel it, to live. So if you have weakness in, let's say, the pancreas, the colon, the liver, the kidneys, those stem cells are going to go fix your internal organs first. Praise God to that. And then it's going to hone in to the next thing you need and the next thing you need and the next thing you need. And pretty soon, the next thing you need is going to be something you feel, like our friend Bob Campbell. It took 6 months before the stem cells went to his knees, which he had 6 surgeries on. And what bugged him the most, on the 6th month, his knees popped and he could bend down and play with his grandkids again. I'm not kidding. Now, he had all sorts of other amazing things happen, more energy, not taking naps anymore. If Bob's on the call, he's in his 70s, but he would say he looks like he's 30 if you all know him, right? But he said, honestly, my knees are now mobile, and it's pretty exciting. And he said this to me once. He goes, Marci, if I was only concerned about my knees and stopped, I would have never had these great results. So I like to think about that. Dr. Patty says the stem cells, I say this all the time now, act as honing birds. They hone into your most inflammation, fix that first. Then they hone into the next inflammation, fix that next, and so on and so on and so on. The army now is marching again, like when you were young. Dr. Patty, explain, why do we wear the patches? Okay, let me explain how we wear them, and then we want to know why. So this is the patch. You wear it 12 hours on to activate and repair and 12 hours off. That's 12 hours on to activate and repair and 12 hours off. You wear it either right below the back of the neck, below it, or underneath the belly button. But really, your whole body's light, so any spot will do. You can also just love the spot with this patch. If your knee hurts, put it on the knee. If your shoulder hurts, put it on your shoulder. I've been having the worst colon issues lately. Where have I been putting it? Right on my stomach, you know, a little above my stomach where my colon is. That's okay too. So Patty, why does any spot work? Why does David have a couple recommended spots? And why 12 hours on and 12 hours off? Why is this the usage protocols?
Right. Well, you know, David says, again, like what Marci just said, that you can use any spot, but specifically when you do trials, you have to sort of hone it down and get everybody to do the same thing so that then you can report something that's truly valuable, and you haven't had so many variables that you don't really know if it was the patch that did whatever they're trying to say. So he recommends that the X39 and 49 be used 2 finger widths below the belly button or on the back of the neck if you're wanting to match what the trial showed, which was something very valuable. If you have a specific place of pain, then it makes sense also, and he says this, that you can put it on that spot, because again, what's it doing? It's the light activating therapy. So think about when you go outside and you get sun, and that's your body converts that into the vitamin D that you need. Well, it's the same idea. So you put that patch on this specific area. It's an energy meridian of the body. All through our body, we have these special energy meridians. And if you've got pain, that's one. You just can put it right there, and it helps deflect that healing light back into that area. So it makes sense that it would work. So you can try it. It's a bit of a art. I always say medicine is not just a science, it's an art, and it's a customization and individualization for every patient. And so that's what we get to do with the patches, and I like that.
Wow, Dr. Patty. And I love that it's an art, which means that it's an art, but it's a science, and that there's research behind it. And I love how Dr. Patty explains there's 100 research articles. Of course, David's going to have the spots to do the research because he wants to know the research. And once again, doctors on this call, if you want to see the research, go to startx39.com. That's startx39.com under research and patents. You'll see 100 research studies and a whole lot of patents. So let's talk about 12 hours on, 12 hours off. The reason that we need to wear the patch on and off, so let's say this again, 12 hours on to activate and repair and 12 hours off, because we are light. And think about if you had a light on 24 hours over and over and over again, would your light bulb burn out? Yes. This is signal-based therapy. So the reason is on and off is because if you wear it 24 hours over and over and over again, your body gets used to the signal and then it doesn't work so well. So it's important to go on and off, on and off. Now, if you're like me and you have a ton of these patches on and some fall out in the shower and some are falling on the floor, or to the park, you'll see one on the sidewalk from a week ago. It just happens. And sometimes you like turn around and go, oh, I still have this one on my back from 48 hours ago. Don't freak out. Just take it off. Okay. It's okay. So that's what I want you to know. So this is the X39. Dr. Patty, you also brought up, so let's talk this next, Ice Wave. What's this and why do you like this patch so much?
I like it because it's such a nice adjunct to the X39. So for my patients, I think a lot of us are using just X39 only, and that's fine. But for my patients, because I benefited myself personally so much from adding Ice Wave because of my chronic pain, it's nice to be able to take out that chronic pain while your body's healing and repairing. And so for me, I put those patches on. I did the whole body protocol. Can you hear that noise?
We can just a little bit, doctor.
You want me to move to another
Sure.
room?
While you're moving, I'll just explain how Ice Wave works for people. So Ice Wave is a pain patch. It does not repair like X39, but it takes the pain away. And David says pain's in the connective tissue. Ice Wave is one of two of our only two patch systems. Has any of you ever have any of you ever had to charge a battery, you know, where you put the positive charge and the negative charge on a battery and it like gets the battery going again? Think of Ice Wave as a positive and negative charge on your own body. You put the brown patch on your spot that hurts the most, and you put the white patch about 3 inches away. And like a negative and positive charge, it breaks the connection of pain in the connective tissue. Now, this once again is not going to repair, but it's going to take the pain away while it does repair. Now, you can pop the spot with Ice Wave. Some of you know that I broke my wrist. It's getting better. Look at that. About 6 weeks ago. And this part hurts tremendously. So I'll put a brown spot right where it hurts there. And I'll put a white spot. I call it block the pain right there. You see what I did? And then you know what I do with X39 to repair that darn thing? Yeah, you better believe it. It goes right in the middle there. And already it's feeling better. So that is how I use Ice Wave. Ice Wave is a pain Band-Aid. It breaks the connection of pain, and X39 repairs. And no, Ice Wave does not have any medicine in it. It does not even have any herbal medicine in it. It's all done by light. It basically activates a light wave in your body, a different light wave than X39. And this wave actually breaks the connection of pain in your body. Can you believe we are using wearable light technology to activate our body without putting anything in our bodies? We're using light to activate ourselves so that we may repair. What a concept. So Dr. Patty, let's talk now about Ice Wave and X39 for you, how you use the full body protocol and why. And if you would not mind sharing the symptoms of MS and how that has, what that is like for you in your life and why you decided the full body pain protocol and how that looks for you personally.
Oh, sure. So, I've suffered, I feel like, a lot with many different autoimmune diseases in my life. We all have our paths to go. And I think that, as I'm healed, I can be a healer. And as I'm a healer, I'm healed. It's all.
Oh, Patty, I messed up. So sorry. Patty, unmute yourself. Unmute yourself.
Oh,
There
Can
you
you
go.
hear me now?
Yes, I can. I was trying to mute someone else that had some background noise. Hold on, let's just try one more time. Okay, now please start again. So sorry. Yes.
Oh, no, no problem. So because I've had a lot of pain, I think it helps me to try to turn that into good for the world somehow. Sometimes that's hard, but that's part of my, I think my journey is I'm a healer, but I'm also a healee. I'm being healed. And so I share all of that with my patients, and it helps me to be empathetic and more understanding. I have pretty much whole body pain from MS, and a lot of people with MS do not have that, but many do. And it's nerve pain, and it's pretty severe, and it starts pretty much at the top of my head and goes to the bottom of my feet. And when I sleep, you'd think that might be better, but it actually, for some reason, gets worse. And so I put 2 patches on my bottom of my feet, and there's a person here that is working in my yard, and so now I've moved to a room, and now I think he's coming in this area. So I can try to move out, but anyway, we'll just do the
fine
best
right now. We'll have you move again if it gets bad. It sounds
okay
fine right now.
All right, good. But
he
anyway,
follows you around, doctor.
He does, and it's the exact same time we have these meetings. It's very funny. And I don't have good internet service in parts of my house, so that's why it's hard to figure out where to go. But anyway, that's life, right? The full catastrophe of the beautiful life.
I love that. Can you say that one more time?
Yeah, I love to say, it's the grandiose full catastrophe, meaning in the best sense, life in all of its goodness, and that sometimes its shadow sides too. But anyway, so I just put 2 patches, one, the white on the right underneath the bottom of my foot, the brown on the left underneath my left foot. And then I put the other 2 patches, initially looking at all the wonderful instructions that we get on the website, I put them on my wrists. And I got a 50% reduction in my pain that first night. I couldn't even believe it. And that's like hip pain, back pain, neck pain, arm pain, leg pain, head pain, all of it. And I was just, I could hardly sleep that night. I was so excited. And I thought, well, it'll probably wear off, whatever. But it didn't. And I began to move the patches around based on my instructions on the website, and ultimately ended up putting them on the tops of my shoulders, the white on the right, the brown on the left, with the ones under my feet. And it's basically like you've got that electrical magnetic field and that phototherapy light field between the bottom of my feet and my shoulders. And I had an 80%, reduction in my pain, and it's sustained. And I've been doing this now for 4 months. So it's
so let
totally
me ask
incredible.
So just to make sure I understand, you do a brown patch on the left, on the bottom of your foot, like right below the ball of your foot. Is that correct?
Right.
And then the white patch on the other bottom of your foot, right on below the ball of your foot. Yes,
exactly.
And then you put one more set, which interesting, right? She's wearing more than one. It's okay if you're chronic, you can wear more than one. She put one on the back of her shoulder. It's always white on right side, tan on left. Can you remember that? White on right side, tan on left. Okay, that's the polarity that she's talking about. Now that's ice wave for full body pain. 80% of symptoms of MS, nerve issues for Dr. Patty went away when she did a 2-patch ice wave system, full body. Now, did you wear X39 with that at night, or do you wear X39 during the day? And the reason I ask you that, Dr. Patty, is remember, 12 hours on to activate and repair and 12 hours off. So if she's wearing ice wave to bed, can she wear it in the morning? No, right? Only 12 hours. But every patch has its own 12-hour clock. So she can pick to wear some during the day and some at night. So what, do you wear X39 with your ice wave at night, or do you wear X39 in the morning?
Well, personally, I wear X39 in the morning. And I do alternate it now on places on my body, but probably for the first couple of months. I kept it in those two specific meridian areas, 2 finger widths below the belly button or on the back of my neck. I use X49 as well during the day. I'm like Marci. I am just so crazy about the patches, and I figure, you know, what do you have to lose? I'm going to try it. I'm going to see if I can activate some things in my body that aren't, you know, doing the optimal thing they should be doing. So I use it.
It's interesting, Dr. Patty. So just to understand that Dr. Patty wears Ice Wave at night for full body pain for symptoms of MS. During the day, she wears X39 for stem cell activation. And of course, these are the stem cells that work like the honing bird for her. And they go in to repair what she needs first to live. And then is going to go fix the next thing and the next thing and the next thing. She just talked about X49. And I'm like, whoa, hold on. Let's talk about that one now. Because think about this. X49 is a stem cell activation patch, just like X39. These are the only two stem cell activation patches that David makes. But X49, okay, let's explain this. X39 activates GHK copper peptide. X49 activates the baby or the daughter. It's the daughter of GHK called AHK copper AHK peptide. Okay, GHK copper peptide, AHK peptides. So what does AHK do? Well, this particular peptide actually activates the building of lean muscle mass. It actually helps to burn fat, ladies and men. It helps to grow bones. It protects your brain and your heart. And it is blood pressure positive, right? Like it helps with blood pressure. And it also internally protects you from cell phone radiation. Did you know that 5G radiation is so strong that there's really nothing you can put on your phone anymore that shields it? But X49 shields you internally. I like to say, what does X49 not do? And I love that Dr. Patty talks about this for symptoms of MS. And Patty, you are probably wiser than I am, but I would say that MS is nerves not talking to muscles correctly. Do I have that right? And she's
where, can you hear me okay now?
Yeah. Is that correct? Where symptoms of MS are it happens in the brain where the nerves then cannot talk to the muscles correctly. Is that correct or not correct?
Well, the main thing about MS is that we learn that it destroys myelin, and myelin is the fatty substance around the nerves.
Okay.
And so as that goes away, the nerves are sort of raw and exposed. And you're right, you can have lesions in the brain or throughout the spinal cord.
So would X49 help because it does help to build the lean muscle mass? Like, why do you wear X49?
Trying to clean up a little bit for you. Can I get your bottle of water in here?
One moment, please. Okay, Dr. Patty, you need to unmute yourself. Thank you. Let me ask to unmute you. You need to unmute yourself, doctor. And doctor may be frozen right now. Dr. Patty, I think you're frozen. You can come back in. So X49 actually helps with, oh, there she is. Are you there, Patty?
Yes,
Okay, so why X49 for yourself personally based on what you know about your symptoms of MS? Why did you add this as a protocol for you?
Well, I had never heard of AHK copper because we only use GHK copper injectable. And I read a little bit more. A is just a different amino acid, alanine, instead of G for the glycine. And so I thought, wow, I think GHK copper is such an important peptide. I know this one will be rejuvenating for me as well. I love all the parts of it rejuvenating, all the way from the cell phone idea to the fact that it makes you stronger, makes your muscles stronger. I don't want to waste away as I get older. I want to be strong. I want to have good workouts. I don't want to have flab on me. I want to have muscle, you know? So if I can have all of those good choices, I'm going to go for it. And certainly it's very helpful for tissue repair in general. And so I want to repair any damage that lesions from MS have done in my brain and my body. And I think it helps there too as well.
Oh, I never thought about that. The
Mhm.
tissue of repair,
Yeah, yeah.
of course.
Mhm.
So do you wear Eon?
I do. And so I wear Eon. In fact, I want all of my patients that get X39 to get Eon so that they can have coverage 24/7. So I wear Eon at night because it decreases inflammation. That helps the stem cell patches to work even better. And so I wear them in the daytime, the Eon at night, along with my Ice Wave and Alavita. And so I love that regimen that I have because it helps me sleep better, deeper sleep when I don't have pain, certainly. And I know that I'm losing a lot of inflammation and reducing that at night is what I believe. And I think it works great with my stem cell patches for daytime.
Well, it's interesting because they say Eon is the gentle giant. It's the patch that puts you in rest and digest. It's like the lavender of the line, but just because it's gentle does not mean it's not powerful, right? And there's an interesting story about Eon, and I know a lot of you practitioners will like the story. So David Schmidt, the owner, inventor, and CEO of the company, was invited to Suzanne Summers' house. And I don't know if you guys remember her. I do, because I was born like in the 60s. So, you know, Three's Company, the famous Three's Company, Suzanne Summer. I can't remember what her name was on the TV show. I should know that. I'm sure one of you remember. Chrissy, that was it. Was it Chrissy? Anyway, okay. So invited to her house. Well, he was excited to go because he found out there was going to be a famous scientist there. And the famous scientist was into natural therapies for people that have fast growing cells like me. And he could not wait to meet this man. So he's talking to the man, and the man and him are talking. And he says to David, well, do you know why the queen bees live 50% longer than the worker bees? And he said, no, why? He goes, because it's the royal jelly. She's the only one that gets to eat it. And there's a peptide in that royal jelly that gives her 50% more longevity. And by the way, it's the same peptide that helps fast growing cells not grow so fast. And therefore, I'm not going to be able to tell you what the peptide's name is. But let me tell you, you make it in the stomach. And so David went back to figure out how to make, how that works. And turns out humans have that same peptide. And Eon activates that peptide in your liver, not your stomach, in your liver. And it actually helps to reduce inflammation. And it puts you in rest and digest. It's the gentle giant. And it activates the queen bee jelly peptide in you for longevity. Like, if that's not enough to put Eon with your X39, I don't know what is. And Dr. Patty says this, inflammation is eaters of stem cells, okay? So when you activate your stem cells with X39, but you have a ton of inflammation, what happens? The inflammation goes and tries to eat the stem cells like a Pac-Man. But if you can reduce inflammation with Eon, what's going to happen? You're going to make the stem cells work even better because you got rid of the inflammation. So I love these two. Patty wears X39 during the day and Eon at night with her Ice Wave, I'm sure, to help her sleep. I wear both of these together always. So you decide what's best for you. That's when Dr. Patty said that it's your body and you get to decide what's best for you. So I just love Eon and X39. These are, for me personally, this is the workhorse of the line for me. These are my two personal favorites. I never go a day without wearing these. Doctor, you know I'm coming to this one. What is it?
Well, I love it. And I was telling my husband, Alavita, I was saying that every person I've met that does some webinars in LifeWave has the most beautiful skin. And as you always talk about, not the turkey neck, And I was telling him about that, and I said, we had been using a different skincare regimen with ourselves and our patients that I think is excellent. But I think this is even better. And I said, but everybody looks so good. I met with somebody yesterday who's, I think about 70. And I mean, as you said, you were talking about other people. They're much, much younger looking. And so I think Alavita, the patch itself, coming from the inside out and using the cream, day and night cream, from the outside in, it's one of the best ideas I've ever heard of. So I love it, and I'm using it now. I also know it gives me deeper sleep because when I added it at night, about a month after I started all the patches, I was dreaming so much more again, like I used to when I was younger. And I know I'm getting deeper sleep. So I think it's a great thing. I love it.
Well, I'm going to show you why she says she wears it at night. Because David likes it right between your eyebrows, right there. And that's awesome, except it's hard to wear that during the day. So we wear Alavita at night, and every night it goes right there. And what Alavita does is it changes your energy read from a dark purple energy with holes, literally in 5 minutes, to the gorgeous turquoise of Alavita. In fact, David made the color of the packaging of Alavita the same color as what your energy looks like after being on it for 5 minutes. Who doesn't want to be turquoise energy read, right? It's gorgeous. That's what I saw. When I saw, and you can go to startx39.com under YouTube. There's a YouTube tab and it's called LifeWave Health. That is the company's YouTube channel. And you can search any of these patches, David Schmidt and Alavita, David Schmidt and X39, David Schmidt and Eon. Watch the hour videos yourself. When I watched the video on Alavita, I started wearing it because I saw the scan. And he says the reason that it goes to the beautiful turquoise in 5 minutes is because Alavita in 5 minutes, by putting it on your pineal gland, I think that's correct, that's a very powerful gland, it basically reduces something called oxidative stress. Well, I know Dr. Patty knows this, but I mean, I had to learn all this. Oxidative stress turns out to be something called free radical damage. It's once again, it's the little Pac-Man that destroy your cells. So the two things that really make us old is inflammation and free radicals. So if we can reduce both of those, we're going to look much better, right? So Eon reduces the inflammation. Alavita and actually Eon and glutathione reduce something called the oxidative stress or the free radical guys. So what do I mean by that? Well, just by the food we eat, the water we drink, we are in a much more toxic environment, David says, than even 20 years ago. And then just the working of our bodies, like a car, when you drive your car and you see that exhaust, well, just working your body, guess what the exhaust of your body is? Free radicals. So you need something to neutralize it. Alavita neutralizes that free radical damage. And that's why when you start wearing it, I can't believe it, but your skin starts to glow. Your chin gets tight. And for us older women, we are not getting turkey necks. And that is Alavita. Then you put on the night cream and the day cream. David made these creams. And by the way, I love the way this works. I just figured this out recently. This opens it and that shuts it. I can't believe it took me 3 years to figure that out. But that basically matches, it's made with algae oil and it matches the exact same oil of your skin. So it goes right in. Then it has fat soluble vitamin C in it, and it has milk peptide protein. Both help to build collagen by activating something called hyaluronic. It's pronounce that word, Patty, something acid.
Hyaluronic acid.
That's a tough word for me. Yes, that. And so that is why the collagen starts to rebuild. So the two patches that build collagen are X39 and Alavita. And the coolest is you can get 2 Alavitas and the day and night cream for $150 in the skincare kit. What do I mean by 2 Alavitas? 2 sleeves, 2 30-day sleeves. Do you know the price of these are $69? Can you believe you can get 2 sleeves and a day and night cream for $150? Okay, I'm just going to give you a little secret. Whenever I need Alavita, you know what I do? I always buy the kit because it's cheaper than buying 2 sleeves. And then I get my day and night cream. Now I have enough day and night cream. I use it on my legs and my arms now. Fun fact. It's so awesome. So that's Alavita. And I love that patch. I do have, shoot, we only have 5 minutes. I guess today we're just talking technology, Dr. Patty. Next week, remind me, we'll end early and we'll do 20 minutes on how to set up offices. But today it's technology day. And Lori, I'll call on you in, well, go ahead, Lori, say what you're gonna say. Yep.
Well, first of all, Dr. Patty, thank you so much. You gave me so many more ideas. I've been using the patches for about a month. So I'm experimenting on myself. I'm working with my clients. I'm seeing some amazing results.
Great.
One of the things in talking about the pain, and I won't tell you all the testimonies because I have a few, but I'm just going to share with you what I was noticing. One day I woke up and I realized that Nirvana increases the beta endorphins. And although it's indicated for mood and anxiety and a few other things, I started using it on this point right here, the acupuncture point that we normally would use it for like, say, if somebody has a headache, right? And I noticed that this particular patch, their Nirvana, was activating my beta endorphins and impacting my pain personally. Because you know how we have to play around with these patches and kind of get a feel for our own bodies and what works for us. But I'm going to try the ice wave the way you shared, because I also experience more inflammation in the middle of the night. My body's really working hard to go into the repair mode.
Yes. Thanks for sharing that about Nirvana. That's great to know.
Yeah, it's so exciting.
Well,
So,
and I'll tell you, Lori, and maybe doctor could have an opinion on this. What I'm hearing is after 6 weeks of Nirvana, so Nirvana is the patch that elevates the endorphins, all the different happy hormones in your brain. And David says after 6 weeks of using the Nirvana system, which is the patch and the tablets, and these are actually made out of seaweed. So they actually grab the toxins and you can poop them out, basically, the toxins. Together within 6 weeks, Nirvana acts like the painkillers that are so bad for us to get rid of pain. In 6 weeks, it acts like the endorphins of Nirvana basically bliss the pain away through the brain. And this is wonderful for chronic pain patients that are on massive pharmaceutical pain pills when they end up being so toxic to the liver long term. Yes. So what a lot of people do, Lori, is they get at their pain on a 24-hour clock, right? They'll either do ice wave at night like Dr. Patty does, and then Nirvana during the day, or they'll do ice wave during the day and Nirvana at night. And these are for super chronic pain people. This is a really great 24-hour pain protocol. And while you're at it, Nirvana is also going to make you happy. So this is the one that is the happy patch. And so if you have clients that are struggling with mood, this would be a wonderful patch as well. So Lori, thank you. Dr. Patty, do you have anything to add to that?
No, I was just looking through the chat and I know there's lots of questions. Maybe sometime we could just do a Q&A, and that would be great, and share all of our, things that have worked and things maybe that haven't worked so much, and put it all together. So thanks to all of you. And thank you, Marci. I think you look extra great today. Your hair is shining, your skin is beautiful, and you're a wonderful model for us. So thank you.
Oh my goodness. Okay. Do you just love her? She just light and love. Like, have you ever met an MD that is so full of light and love? I never have. Like, you're the best.
No, thank
So-
you. Thank you. Thanks to
so-
all of you.
It's 9:59. We're going to end our call with one last patch because we cannot end our call without talking about it. Next week, we'll talk. Jan, if you could please write a note so I don't forget. I want to finish at some point all of our patches. Of course, we always talk X39, but then we will also next week talk energy and SP6, unless I've missed one, because we're going to talk glutathione real quick. So next week, we're going to talk X39, energy, and SP6, and then we're going to run through questions and answers. That would be fun. And we'll take
Good.
the last 15 minutes to show how to set up practices. Jan, if you could take those notes for me and text those to me now so I remember, that would be great. Okay, so let's end the call on glutathione. Who doesn't want to end the call on glutathione? Dr. Patty, tell us about glutathione. Tell us about why people are spending 3,000 a year, 300 a visit to do glutathione IVs, and what the difference between glutathione IVs and something like our patch of glutathione. And what is glutathione? Why is it even important?
You hear people call it the master antioxidant. And what that means is it's able to attach to toxins in your body and remove them effectively and more quickly. And so it's very powerful. I had not been able to ever take a glutathione supplement before because it was always too strong for me and made me too weak. However, when I saw the glutathione, the patch would just help my body to produce it better, I began to gradually introduce it. And now I'm able to wear it all day long. I do it 3 times a week, but I started wearing it 1 hour a day. So it's a great thing, and I recommend it for every person because we have to detox. Even if we eat as healthy and clean as we can, we're in a pretty toxic world, and so it's important.
And, you know, you always told, like, I'm a big glutathione person because I have a special needs child who autism, and we've always been working to get his glutathione working because we've always felt he has a lot of metal in him and we need glutathione to push it out. So we've always taught glutathione. So in my family, glutathione was a big word. And so about 5 years ago, when I was dealing with symptoms of breast cancer, I was going to get glutathione pushes at a clinic. And I realized that when I did those glutathione, even though I knew it was so good for me, I never felt that good. What's going on with some of those pushes?
So the pushes push it literally into the body. They're usually done at the end of a vitamin IV, and you do a glutathione push right at the end. And you can't put it in the IV itself. You have to do it right at the end so it doesn't form crystals. And it can be very powerful. Sometimes patients will have a response to it, though, where they get a really bad headache or a rash. And it only lasts a short period of time. It's in and out. Whereas with the glutathione patch, we can keep it on in a gentle way. It's going to increase our glutathione maybe 300%. We've been shown in some studies, but I think that it makes a difference in that you've got it on there, it's more gentle, and it's going to just constantly detox. And I've heard David Schmidt say, for people that really need to detox, you might want to do it every day for a couple of weeks. And then after that, you can use it maybe 3 or 4 times a week, or if you're traveling, if you've been exposed to something, because it will, again, be very helpful for your immune system.
And what I remember you saying is that when you do the glutathione IV, it only has like a 7-minute half-life. So you're getting that big push, maybe a detox, and then it's only in your system for 7 minutes. Where the glutathione patch, this is going to activate your own pathway 300% for 12 hours. Is that correct?
I don't know for sure how long it's in and out of the system, but I do know it's much more quickly removed that way as it comes right into the bloodstream. It doesn't last as long, so you want to do it more frequently. and you're not getting that coverage as long. It may dump out quite a bit that moment in time of toxins from you, which is why sometimes it's a little too powerful, but then you're right back into your norm. So I think it's much better if you can do it consistently and stimulate your body to produce its own glutathione. That's our natural detox system.
And just so you know, glutathione, the pathway of glutathione is your detoxification pathway and your antioxidant pathway. Glutathione is in your system. It's a pathway in your system. And so basically, I like to say that X39 is the workhorse of the line, Eon is the gentle giant, and glutathione takes no prisoners. This one is the one that detox you the most. You could get a headache. You could end up having a little diarrhea. Drink plenty of water while you take glutathione. Stuff will come out of your skin. I had big bacteria just pop out of my back when I started. And so one thing that Dr. Patty likes to talk about is you can wear a half of a patch and titrate yourself up with glutathione. Any of the patches you can titrate yourself up with if you feel like you're having some sort of a detox. And what does that mean? Never cut it. If you cut the crystal, it doesn't work. So you just unstick half, and you could wear half of a patch for 3 hours. And then the next day you could wear the other half of the patch for 6 hours and slowly work yourself up to a full patch for 12 hours. So with that, Dr. Patty, let's go quickly to Lori, our practitioner, Lori. She had a testimonial on glutathione, and then we'll end the call. Go ahead, Lori.
So, you know, it's interesting. We don't really think about our lungs as being a detox mechanism or a detox organ, and yet it is. So years ago, when I first started doing biofeedback, I would work on my husband, and I do biofeedback on him because he had a genetic weakness in his lungs. So he'd get pneumonia and bronchitis many times in the year. Fast forward, I've been a practitioner for 20 years. When I'm working with, say, like anybody that I know, like by the time somebody has cancer, they need to actually know about glutathione. And most people don't really know it. They don't know that our stomach acids will destroy the glutathione. So I usually send them home with like some information, like read about this, educate yourself about glutathione, and go find a functional medicine doctor where you can get an IV. Now, I've been using the patches for a month. And I've been experimenting with my own husband because after we traveled around the world for 4 years with backpacks, I didn't have my biofeedback device. I didn't have any of my energetic tools with me. And he contracted reactive airway disease. And we also found out he had a tear in his aortic valve. One of the biggest things that happens when he has the reactive airway disease is when he starts to cough, which can get triggered in any environment. He'll start to cough, and he'll cough for months, okay? And if he goes from one environment, which is maybe a cold environment, to a warm environment, or a dusty environment to a clean environment, anything can keep that cough going. He's reactive, right? So a month ago, we started using the glutathione patch and the X39. Those were the two I really got him started with. And prior to this, he's got a very busy lifestyle. And you know, that this is the easiest thing for busy people to use because it takes less time than brushing our teeth. And this was one of the issues I had with my family. My husband's running an over $2 million business. He doesn't have time to do some of the things I would like for him to do, even though he's really, really good with his diet. So 2 months ago, I started him on the patch. And prior to that, he'd gotten on a steroid, and the steroid didn't work this time. Because we know that if you have an overabundance of antibiotics, or you have an overabundance of steroids, the body just shuts off and says, you know, it's just not working much. So in 2 weeks' time, he literally stopped coughing. We increased his immune system enough where it kicked in, so he's not coughing anymore.
Wow.
And this is I am so excited about this. Like, this is just one of the most exciting things for me, because the concern that he's going to cough and split that aortic valve in his heart, or get a buildup of scar tissue from coughing so much, right, Dr. Patty? Because those were my concerns.
Yes.
Those are my biggest concerns.
Absolutely.
So I just wanted to share that. because that's
Thank
like my
you, Lori.
personal thing and I'm excited.
Yeah.
to do that.
Well,
Yeah.
I will say this and then we'll end the call. I'll say that it's exciting to learn about this technology, and it's very exciting for me when practitioners who are responsible for helping so many people are noticing this technology for their clients and themselves. And it just fills my heart with joy. So with that, Dr. Patty, why don't you end the call for us today?
Well, thanks to all of you. I hope you have a great week, and we'll look forward to next week to have a little time for question and answer and go through some of the other patches. Bless
Thank
you
you so
all.
much.
Thank you,
Bless
Marcy.
Bye-bye, everyone. Thank you, Lori, for your commentary.
Yes, thank you, Lori. It was perfect.
Bye-bye.
Bye.